Treatment planning always begins with data collection. For that portion, we'll do a detailed examination. Sometimes we have photos, we have x-rays, we make models of your teeth so we can look at them from different angles, or we can scan the mouth so that we have a digital file as to what your mouth looks like. Based on all this information, we next go on to talk to you more about what your problems are. Once you have an understanding of what the problems are, that's when we begin to show you the options as to what is possible and what can be done to address these issues. We take many factors into consideration, such as your health, your lifestyle, your habits, and any anatomical limitations that you might have. After that, we devise a treatment plan which is tailor-made for you, and not a one-size-fits-all option that can be applied to every single patient. A treatment plan is not just a destination, it's also a journey, so we will sit down and give you a detailed path as to how we're going to get to that end goal. Sometimes, this path involves certain breakpoints where we can put you in a holding pattern if financial considerations are an issue for you as well. Once we're done having that discussion, you'll be provided a physical copy of your treatment plan to take home with you. We don't pressure you to make any decisions on the day off because sometimes it is a lot of information to take in. That's why you have the chance to go home, think about it, consider all your options before finally coming to a decision.